So I'm doing the round block incision. This is level 1 oncoplasty, and my tumor, you can see it's away, but I will mark my plane of dissection much beyond the tumor. So that is the area of dissection, and I have marked the outer border of the breast as well. And this is just a sentinel lymph node biopsy. I've done just a blue method and dissected the blue node, and now I am going for the breast. The sentinel node has gone for frozen section. By the time I will finish my breast, the result will be back, and based if the sentinel lymph node is positive, I will go for axillary clearance. Otherwise, I will spare the axilla. So I am making an incision all around. And you should be very careful that this incision around the nipple should not be very deep, otherwise the supply of nipple will be cut off. And then I have deepitalized the whole tissue, and so this circle I have deepitalized. Now I am deepening the incision around the tumor, so I have marked the clock position, and you can see that blue dye is appearing here as well. And then I have raised the flap. A very important technique I found was using these two fingers to retract the flap and raising the flap in this mastectomy plane. So you could see this is a relatively avascular plane, right? So you can dissect very easily, and I'm going much beyond the tumor, right? So this mastectomy flap I will raise, I'll find the plane and raise this flap much beyond the tumor. And you will see that I have raised the flap up till the most superior border, where I have marked the superior border of the breast. I have raised the flap there, and now I'll dissect or excise the lump or excise the lesion, and I'm going up to pectoral fascia. And once I have gone up to pectoral fascia, like I do in mastectomy, I'll raise this lump from the pectoral fascia first. And once this lump is in my hand, I'm now excising. I've palpated this lump. This lump is in my hand. My fingers are beyond, and now I am excising. This is the medial border. Now I am coming for the incising the inferior margin of this lump. So for the whole time, this lump is in my hand with margins. And now I am excising the inferior border. And what I will do is, still the specimen is attached in the same position. And I have not taken it out from the table and then orienting it, because at that time there might be some discrepancy, right? I might forget, or the lump will move. So while it is in situ, I am orienting this specimen, and the standard orientation is short sutures superiorly, long laterally, and double loop in the posterior margin. So avoid funneling. It's very important, and you can see this has come out as a single solid cylindrical specimen. You can see this. I'm again palpating the tumors and palpating the margins as well, and then I have oriented the deep margin. And now again I am raising this breast pillars so that I can close these breast pillars. So you can see I have mobilized the breast pillar as, and there is this defect. And before closing this defect, I will like to clip the cavity. So very important, because this clipping will help my radial therapist, so that if he wants to give boost to the tumor bed, he can give. So because boost is important, as most of the local recurrences happens within this tumor bed or within 2 centimeters around it. So they would like to boost that area. So I am putting the clip. So there is no particular guidelines for how many clips to put, but you should orient all the margins, right? Posterior with the and all the margins. Now I am closing these pillars which I have already mobilized. I am closing this. So this is done by, these are deep sutures I am putting it. So you will see how nicely these pillars have come together, and there's hardly any space left. So I am closing this, and this this little tissue I am using to fill in that gap. And these are all absorbable sutures, and of course I will put some subcutaneous sutures now. So ultimately this nipple will close, and if you are worried that the closure will, you can put some staplers to orient this nipple at the center, rather than, because nipple can pull towards one or other side. So So this is the final closure. This is